Hello, and welcome to another exciting episode of the Medical Moment. I'm Dr. Valerie Walker, and today we're going to focus in on breast cancer and breast cancer awareness. As most of you all know, October is Breast Cancer Awareness Month. So, throughout the month of October, we're going to be talking about breast cancer, and we want to know how you feel about breast cancer. When you look at your breast every morning, what do you see or what do you think about? A lot of people, especially you men out there, you think about breasts as being something like a sexual object. Or you may look in the mirror every morning and stare at your breasts and say, oh, I think I need a breast implant. Or I need a reduction. They're too big. They're wearing my shoulders down. They're making my back hurt. Well, today we're going to talk about a subject that nobody wants to hear in life is you never want a doctor to walk in a room and tell you that you have breast cancer. Did you know that in America, every 2 minutes, a female is diagnosed with breast cancer? And I'm going to let my producers clue me as to the 2 minutes, and we're going to start it right now. And when he clues me that 2 minutes have ended, somebody somewhere has been diagnosed with breast cancer. And breast cancer, we need to know, does not always affect women. Breast cancer affects men also. So men that's looking at the show and you want to switch away because you want to say, oh, well, breast cancer just happened to women. No, 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 no. Breast cancer is also diagnosed in men. In fact, this year alone, over 2,000 men will be diagnosed with breast cancer, so it's just not for women only. Breast cancer affects 1 in every 8 women, and what that means that in a woman's lifetime, 1 out of 8 women will be diagnosed with breast cancer, and actually they're predicting that this year alone, over 218,000 women will be diagnosed with breast cancer. It is the second leading cause of cancer in women, right behind skin cancer. And skin cancer because, as you know, your skin is the largest organ in the body. So when people ask you, what's the largest organ in your body? You may say something like, oh, it's my brain. Oh, it's my liver. No, it's your skin because of the amount of territory that it covers. I think 2 minutes has probably just went by, and guess what? Somebody has been diagnosed with breast cancer. So just let's explore it for a minute. What is breast cancer? How does it start? Well, actually, breast cancer is cancer that starts in the breast. But what you got to remember is, depending on the part of the breast that it starts, or the tissue that's affected by breast cancer, or the cells that are affected by breast cancer, there are actually different kinds of breast cancer. So when you just say breast cancer, it's just not, oh, everybody gets the same kind of cancer. No, the common thing is breast, but there are different kinds. And the different types of breast cancers, number one, you can have what we call an angiosarcoma. That's a form of breast cancer. Ductal carcinoma in situ, we call that DCIS. That's another kind. Inflammatory breast cancer, and that's really a bad. All cancer is bad. Let me just make that clear. But inflammatory breast cancer is really bad and really aggressive, as most of them are. Then you can have one we call invasive lobular carcinoma of the breast. Then we have male breast cancer. And like I said, 2% of men will be diagnosed with breast cancer. So it's just not exclusive for women only. And also Paget's disease of the breast. So you ask yourself, so what are the symptoms, Dr. Walker? What should I look at? Well, let me just tell you this in brief. There are a lot of famous women who have been diagnosed with breast cancer, and all of them have a different story to tell. They have a different treatment plan, and later on in the show, because this is going to be a two-part, part one and part two, when we talk about, the different treatment modalities, a lot of the women that I'm going to tell you about real briefly all had something did separately and differently with their breast cancer. And we'll start with, y'all remember this show, Three of a Kind, years ago, and there was an actress all named Suzanne Summers. Well, she decided to go natural with her breast cancer. She actually published a book about it. She didn't want to do, I don't think, the radiation and the chemo and the surgery, which is some out of standard treatments, so she went natural. Then you had the First Lady of the United States, Nancy Reagan, who was married to Ronald Reagan. And what she did what we call a lumpectomy, meaning you go in and you get the area in question for the breast cancer, and then you make sure you have what we call clear borders around that area that you removed. And then you got Minnie Riperton. Many of you remember her. She had a voice that was just angelic and could just hit notes that I would try to hit myself in the shower and came nowhere near it. She not only had breast cancer that took her at an early age. One thing I've noticed, and the things I'm telling you all the time on these shows, are things I'm sharing from experience of seeing thousands and thousands of patients over the years. I've noticed that when breast cancer hits you real young, it's really, really bad because your immune system declines as we get older. So you would think that, when you're young, you could fight it off better, but it took Minnie Riperton, and she was one powerful singer. If you get a minute, go listen to some of her CDs and you'll see. And then just newly, we've heard that Katie Couric, I think she shared that she had been diagnosed with breast cancer. Her husband, Jay, had colon cancer, and she's been a big advocate, and I love her for that, for early detection and early screening, but I think she herself. So what I said all that to say is breast cancer spares nobody. It's more common in some people than others, but if you're a female, which is one of the biggest risks for breast cancer, and have a family history of breast cancer, meaning your mom, especially a first line relative, like your mom, your sister, or your daughter, then it doubles your chances of getting breast cancer. So it's very common. Second commonest one in women. And the biggest thing we're going to stress throughout these shows and presentations is that we need early detection to try to get to a cure. So early detection, early detection, early detection. So, what are some of the symptoms of breast cancer? How would you know? The first thing, one of the biggest things that I've had patients tell me over the years is that they get an itch. And they say, it's like an itch, Dr. Walker. You ever get that itch that just look like it won't go away, one of them strong itches that no matter how you scratch, it's still there? They say that they get an itch in their breast. So just always pay attention to anything going on with your body unusual that you don't remember it happening before, especially if you get this real intense itch in the breast. The other thing is you may feel a lump in your breast. Don't be afraid to check your lump, or don't wait on your maid or your spouse or whoever to check your breast. You check them yourself. And what you're checking for is to see if you feel something that you've never felt before. Like you check your breast for years and years and years, and then you go, what's this? I don't remember feeling this last week or last month. Just always what you're trying to do, you're not trying to make the diagnosis. You want to see your doctor and let them do that. What you're doing is just try to be so familiar with your own breast that when something happens that you know that this was not here. This is very unusual. Did you know the bulk of breast mass are actually found by the patient? They're feeling around, they feel something, and then they call their doctor. So feel for a lump or thickening in your breast. So we got the itch, we got the lump, we got the thickening. And then you want to look at the size and shape and appearance of your breast. If you stand in the mirror and you need to get naked and get in front of the mirror, yes you do, and look at your breast, does one look different than the other? Is one bigger than the other? Is one shape different than the other? Does one have a strange appearance, like what we call like an orange peel appearance, like that little pitting that you see at an orange? Just look and see if you see any of those type of changes in your breast. And also if you have a newly inverted nipple. Now, if you were born with your nipple inverted on your breast, that's not saying you have breast cancer, but you still got to always get yourself checked out. But what we're really looking for is a newly inverted nipple. Like all these years, the nipples have not been inverted. All of a sudden, you look in the mirror and the nipple is inverted, then that should be a problem that you should report to your doctor immediately. Other thing you want to look for is around what we call the areola area, the area right around the nipple in the breast. You want to look for anything like flaking or peeling or scaling anywhere around that area. Now, not necessarily saying it's cancer, but those are some of the things that you have to look out for and that you need to tell your doctor about. The other thing that you want to tell your doctor about is any redness or inflammatory areas that you see in your breast, like all of a sudden part of your breast just fire red, just really, really red, and like I said, may have some of that pitting that we talked about. Those are the things that you really want to look out for. But the biggest thing with breast is always you're looking for a change, something that you have not seen before, something that's very unusual, unusual pain and discomfort in the breast. Don't be scared to call your doctor, because throughout these talks we're going to always talk about early prevention and early detection. That's the key thing with breast disease. Okay, now let's just briefly talk about the breast cancer itself in the breast. And like I alluded to earlier, it's areas of the breast, like the lobular area, the area around the areola, and all. Those are the things that we are looking for. And these breast cells are cells that just grow unregulated. It's like anything in life that gets out of hand and gets unregulated. It can just grow and grow and grow until it spreads into a tumor. And then from the tumor, if left unchecked, it can spread to the lymph nodes. That's why a lot of times when you see your doctor, they'll tell you that we got to do a biopsy. Then we got to check the lymph nodes, because always remember, the thing with cancer is that it loves to spread. It don't like to stay in just one little area and just stay there forever. Oh, I'm just going to sit here and be cancer, and I'm just going to sit here and be it forever. No. Cancer loves to spread. So you always got to realize that when you see your doctor, they tell you they got to do all these biopsies. Let them do it, because they're trying to do this thing we call in healthcare called stage the cancer, to see how far it's gone and what it has done, and then that will dictate our treatment for you and your doctor to consider. Now, the causes is really kind of multifactorial. We have inherited breast cancer. All y'all know the actress Angela Jolie, a warrior when it comes to healthcare and prevention. She took some very, very bold steps. She was diagnosed with breast cancer, and what she elected to do, because there are two genes, the BCRA1 and the BCRA2. Now these are genetic mutated types of genes that we see in women. So if you go to the doctor and you have breast cancer, and your mama have breast cancer, and a sister has breast cancer, you all need some strong genetic counseling, because that means that these mutations run in families, and also it's associated with ovarian and female cancer also. So a lot of times when these things happen, women want to go in and not only, like Angelina Jolie, go in and get the breast removed. They go as far as also get their ovaries, and while they're in there getting ovaries, some women have told me, they tell them get the uterus too while you're there. But all these are decisions that you and your doctor and your family will sit around and talk about and consider. And in healthcare, you always weigh what we like to weigh, the risk versus the benefits. But I always know, if you've got the take home message here is, if you've got a strong history of breast cancer in your sister, your mom, and your daughter, you really want to talk to your doctor and ask them, do they need to refer you for some type of genetic counseling? And that's what needs to be done. In the second part of our show, we're going to talk about who's at risk. Well, we already know right off the bat, female at risk, at the biggest risk, even though men, you all in there too, we know that. And we talked about the family history, and in part 2, we're going to finish up with the risks of breast cancer, and namely, what are we going to do about it? I'm Dr. Valerie Walker, and that was part 1 of Breast Cancer Awareness.